Greetings and welcome to the second lecture for Addicted Family Intervention. This is our lecture on the theoretical approaches to family therapy. We're going to look at a little bit of a history continuation from chapter 1 of where and how family therapy has developed as a specific division or a specific discipline within the counseling field. Also, we're going to look at specifically the role of the chemical dependency counselor in family intervention. Family therapy assumes that personality development lies within the interactions within the family. The family is the first group that we know. It's the group that we interact with on a daily basis from childhood through adulthood to late life. Also, problems therefore may be a function of the family system, and we're going to look at survival roles. We're going to look at a lot of different things, characteristics within the family that inherently should be looked at more specifically in a family therapy theoretical perspective. There are a few theories of family therapy and some specific to substance abuse. We're going to look at those in this lecture today. Dulfano's approach is use the family as a system, or family systems theory. As the families grow, the system changes to help maintain the stability for the family and the individual's needs are met. So a system, much like the way a system in a business runs, or a system if you think of cogs, and I'm going to show a video later this semester that is the codependency in the family. But if you think of cogs that move together, if one of those cogs begins to break down, to move the opposite direction, then that throws the system off. We're going to talk about that in more detail a little later in this lecture today. What if alcohol enters the picture? Then the system is disrupted. The system's normal routines and functions, daily routines, functions is disrupted. And then what we see is that family survival roles are developed when chemical dependency or alcoholism enters the family. If a family member quits drinking alcohol and the family has gotten used to the alcoholic behavior, then we see that the family members, the cogs here, don't want to change because they've gotten so accustomed to their family survival role, whether it be the chief enabler, the scapegoat, the hero, whatever it is. So there's a resistance towards homeostasis. Homeostasis is one of the key words for this class. You need to be sure and understand that that means a homeostasis is when everything is working together and where everything's working in flux towards common goals. If things are out of homeostasis, then things are out of flux. Also believed an entire family system needs to change, which means that if someone does become chemically dependent or alcoholic, then that person becomes sober, that the family members also need interaction, intervention, and help in order to deal with a myriad of different issues that have come from their interaction with the chemically dependent. So we look at Kaufman. Kaufman is one of the other major theorists besides Dulfano here. Kaufman combines several approaches to this theory, and you're going to really cover this in the book as we go forward. Kaufman combined several approaches to his theory. He came up with the term or coined the term enmeshment as it relates to family structures. Was looking for the book in this class really describes, does a good job. I believe it's the middle of chapter 2 to describe these types of alcoholic families. You definitely, it's the Olivia Curtis book, and the way that she describes it, and here I'm going to go ahead and go to the chart, it's the functional family system, the neurotic or enmeshed family system, which is the crisis state family, the disintegrated family system, where the family has come into parts or separate entities, and then the absent family system. So if you look over here, the functional, or when we say a functioning alcoholic, in other words, the person is functioning, they're still drinking, but there may not be what we call a substance user or have a substance use disorder, which is with the DSM-5, the categorization is no longer going to be abuse or dependence, but it will be a substance use disorder. So this person would be dealing to drink with problems outside the family. That would be problems at work, problems related to peer pressure. The family is stable, healthy, and has good relationships. Interventions would be education, because what we see is that someone who's a functioning alcoholic may be an early stage of alcoholism on the road, where it would only take a few minor crisis to cause dysfunction or disequilibrium in that person. The neurotic tries to control the family, partner, or to anger others, or isolate, or resent, or use isolation or resentment, and that's why the person drinks. The person drinks as a way to feel in control of the family, or to feel that drinking is the one area that they have control over. When we think of neurotic, we think of when there's an excessive amount of focus on a certain area. Conflict, role shifts, poor communication, projections. The spouse, family tries to control the drinking, may feel guilty about them drinking. This is the way the family is. The family is definitely trying to come to terms with the drinking, and may really have a difficult time even admitting that the family member is drinking. Some interventions are education, family therapy about roles and ineffective behaviors, which is going to happen in most of your IOP or IOR, your intensive residential or outpatient. Al-Anon or AA, Al-Anon for the family members, Alateen for the teenage or children of alcoholics, and then AA for even the chemically dependent. The disintegrated family is same as above, but to a higher degree. At this point in time, there's a loss of control. There's higher degrees of enmeshment. Alcoholic may be out of the home now, and the other family members may be coming together in order to deal with the loss of connection or the loss of the relationship with the chemically dependent. The interventions here using drinking is very heavy, personal counseling to help reduce that. Then the family is brought in to maintain that and discuss roles. Disintegrated family is the lost family. It's the family that no longer knows how to deal with the drinking crisis. If we look at intervention on A&E, whenever someone gets to the point where they're doing an intervention, it's most likely in the disintegrated mode. In the absent, why the person drinks, there's no telling why the person drinks. There's a total separation from family. Relationships are based on alcohol. Low amounts of trust, resentments, or broken relationships. The absent alcoholic, or the family that is absent, may have stopped hanging out, or may have stopped interacting with the chemically dependent in order to, because of their behavior when they're drinking, and they may only hang out with other family members who also drink, because at this point they only feel comfortable around those who are also drinking. After sobriety is attempted, in treatment, the basics of social network need to be built. No guarantees here. Family intervention at this point is seen to be a place of helping the person to realize their negative behavior patterns, and then help them to change those negative behavior patterns and shift them to more positive social skills and family skills. So the next models I'm going to talk about on the next few slides, actually the next 4 slides, I'm going to briefly tell you, and we're going to talk about them in future chapters. We're going to talk about them in more detail. However, the most commonly used therapy right now are the disease model, the behavioral model, and the family systems theory, which is what I was telling you about earlier. Note that most use a variation to conceptualize. In other words, the word eclectic, it means that someone draws different pieces from different theories when it's appropriate for different clients. Some are more effective than others. You'll see that some are controversial, some are more effective, and but in most cases, these are the models you're going to see that are used in the field. The disease model is one of the most popular in substance abuse counseling. It sees it as a family disease, Family members are called codependent, may not drink but have similar characteristics. We're going to call it a somatic. Psycho-induced somatic disorder, or somatic situations where, let's say, a wife has a husband who drinks, and the husband has ulceritis or gastritis, that the wife also would have ulceritis or gastritis as a result of dealing with the behaviors and all of the side effects that go along with caring for and being there for the alcoholic. Also, communication in these families are very poor. The rule of don't talk is enforced. Don't talk, don't feel, don't change. Family is educated on alcoholism as a disease and how it affects the family, and that it is treatable, but that it must remain treated. And it's something that someone has to engage in lifetime recovery in order to maintain sobriety. Research with this model is inconclusive, does lack adjustment issues. Disease model really, from the family perspective, when we talk about the disease model of addiction from the actual perspective of the addict, it is a very founded theory. When we talk about the family as a disease, the family disease, that is kind of controversial. The behavioral model, my favorite model, is the behavioral model. Drinking is maintained by reinforcement, both with the self and the entire family. An example of this would be the person who has had multiple DWIs, where the family members would come together and do everything they can in order to make sure that that person gets their license, even with a breathalyzer. And I mean, I've heard of stories of people who were drinking, and that family members would actually blow on the breathalyzer so that the vehicle could get started. So that's kind of a rough example of that, but drinking is maintained by reinforcement. In other words, if someone comes home and they've had a bad week at work, and the person gets in an argument with their family member about chores, finances, or whatever, and the alcoholic says, well, I'm just going to go drink, and then the family member reinforces that by saying, well, you're going to drink anyway, why aren't you gone yet? Something similar to that. The goal here with the behavioral model is to help the family reinforce the alcoholic's behaviors. What kind of behaviors? Reinforce them to attend meetings, to see a counselor, reinforce them to, reinforce them in, the thing that we say about alcoholics is that stopping drinking is not the end of problems. Stopping drinking is the beginning of problems. Many alcoholics will say that they feel like that their problems should go away if they stop drinking, but oftentimes we know that that's the opposite, because the problems that the person hasn't been dealing with are going to come to the forefront or come to light as a result of not being intoxicated or inebriated on a regular basis. Especially the way you can relate this to your clients when you get into the field and you begin to work with clients is you can let them know this. If you say on a list, this, or this, and as a result of saying this, you can say, I drink because of this. It could be my family, my job. I drink because of the weather. I drink because of finances. If they say anything like that, if they say I drink because, or I don't drink more than or as much as the other person, then those are all keys of those type of behaviors. Also focusing on coping skills of the family, how to teach the family to also, the behavioral model can be used as part of larger programs. We know about therapeutic communities and other type of programs, contingency management, token economies. There's a lot of different programs that can be used with the family, the things that we use with regular therapy or counseling. We can also use it in family therapy on the behavioral side. Is there effectiveness? Relapse prevention is a big part of this. There's still research being done to see the effectiveness of the behavioral model. For the most part, your cognitive behavior or your behavioral model in any type of counseling is going to be what's considered evidence-based in today's field. Finally, we have family systems. This is the real deal for the family. It emphasizes how families are organized, hierarchies, order, different types of authority and roles, and examines the idea of homeostasis, or what it takes for the family to adapt and to function in a normal pattern. States that interaction patterns, family structure, and roles are organized around the dependence when there's chemical dependency. And the specific problems set aside and the alcoholic or the dysfunction is addressed. The family roles or family interactions, redefining roles, repairing alliances and generational issues, what families members do to contribute to drinking with stress, anxiety, or other things like that. Now, here's a key to understand about this. It's important to understand that there's a term called arrested development. I told you all about that in the first lecture. Understand that when the roles in the family are set, that oftentimes there could be an adult child of an alcoholic, and this adult could be the person in your treatment. And this adult may have children of their own, and this adult may also have parents that are still alive and may have issues from their childhood relating to a parent or other family member using drugs while they were younger, or neglect, abuse, exploitation, anything like that could have happened to this adult in your group, and therefore the cycle is happening again, and that cycle could be passing on to the children of this adult in your group who still has issues and problems with the adults from their childhood, their parents, that they have not worked through. And this is what we call the adult child of an alcoholic. And then we're going to look at these systems in more detail as the semester goes on. Is it just for alcohol? Of course, it differs from, alcoholism treatment was the first treatment there was, so that's why with the evolution of psychiatry and counseling, it has been seen to be chemical dependence or chemical abuse or just any type of substance or chemical. Of course, we still say alcoholic and we still say alcoholism, but the drug may may differ, but the interactions and problems are similar. In other words, the type of symptoms, reactions, and interactions for heroin is different than alcohol. Is different from pain pills. Or even your stimulants. This goes for any type of addiction. Addiction causes family problems, relationship problems, and such. There are individual nuances, but the concepts are the same. Different things that you may do with someone who has a heroin addiction that may need some type of detoxification, and the time frame for family therapy is going to be a little bit further down the line than it would be for someone who just has a mild cocaine or alcohol addiction. More research needs to be done with the entire family system, and we need to look at what could be the differences between the alcohol and other drugs. And alcohol, or ETOH, is just another, it's a acronym that can be used to describe alcohol, because ETOH is the terminology for ethanol. Okay, that concludes our second lecture. I look forward to seeing you in the next one.